my political leader, Mrs. Kamala Prasad Bisesa, Senior Counsel, members of the head table, the technical staff here with us tonight, and to the thousands viewing and listening to us, both at home and abroad, I wish you a pleasant evening. My friends, last week, Health Minister Terence Dayal Singh said that the country is now geared towards taking the COVID response to the next level, as the focus is being moved from managing the virus to one of controlling the virus. My friends, tonight I will explain to you how this process is being grossly mismanaged due to gross incompetence, and why we will be in a state of lockdown for the foreseeable future. Minister Dayal Singh told the nation, in order to control the virus, we now have to move to the next phase, which will involve vaccinating our population. My friends, if we could control the virus with a robust vaccination program, then life as we know it could return to normal. The health minister then went on to say that the timeline given by the World Health Organization is that Trinidad and Tobago would receive our first batch of vaccines in early March. Very importantly, in our last sitting in Parliament, Dr. Rudal Munilal asked the Prime Minister whether the government had rejected any approach from the government of India to gift vaccines to Trinidad and Tobago. You see, India is in the process of donating 500,000 vaccines, that's 500,000 vaccines, to CARICOM. As our Prime Minister is currently the chair of CARICOM, it is reasonable to assume that Trinidad and Tobago would receive some of this allocation. But Dr. Rowley then stated that no communication was initiated with India, and thus we had no vaccines to receive from this facility. My friends, our neighbor Barbados, through their forward-thinking Prime Minister, Mia Mottley, has requested and has received 100 doses of the Oxford AstraZeneca COVID-19 vaccine from the government of India as a gesture of goodwill. And this is separate from their allocation in Covax. This is the first batch of a potential 200,000 doses for Barbados. Out of this, Barbados is gifting Trinidad and Tobago 2,000 vaccines. My friends, last week, Dominica also received their first batch from India, with a second batch on the way. And this too is separate from the Covax facility. Prime Minister Roosevelt Skerrit said that he did not imagine that his prayers for his country could be answered so swiftly. He also expressed heartfelt thanks to his Indian counterpart, Narendra Modi, for considering his request and recognizing the equality of his people. My friends, the vaccines that are being donated by India are currently manufactured by the Serum Institute of India, and they were dispatched from Mumbai, India, via private jet. We are extremely happy for the people of Barbados and Dominica, but the question is, why did we not pursue the same facility? You see, my friends, we have traditionally strong ties to the government of India. The Mahatma Gandhi Institute of Cultural Cooperation in Mount Hope is the largest cultural center built and run by the government of India outside of India. The Indian government has made it their priority to maintain and encourage cultural relationship with our two countries, between our two countries, My friends, did the other CARICOM leaders tell Dr. Rowley about their request to India? And if so, why did Dr. Rowley not ask India for some vaccines? Would we not have benefited from some right now? Where is our Minister of Health? This is a dereliction of duty, and he should apologize to all of our citizens over the age of 65 who are now in limbo and do not know when their vaccine is coming. This vaccine that has been donated by India is the exact same vaccine that we are getting through the Covax facility. The vaccine is manufactured by the Serum Institute of India, and it's the world's largest vaccine manufacturer. It is currently producing over 50 million vaccines per month. My friends, the vaccine is very easy to store. It stores at a temperature of 2 degrees Celsius to 8 degrees Celsius, which is about that of a normal domestic fridge, and thus it can be moved around very easily. It doesn't require deep refrigeration. Dr. Rowley then went on to say in Parliament that Trinidad and Tobago have been in talks with China since last October 2020 to source vaccines, and this is being followed up. And he was confident that Trinidad and Tobago would obtain this. My friends, my question to the Prime Minister is, which of the Chinese vaccines are currently registered with the World Health Organization? You see, both the Sinovac and Sinopharm vaccines are currently in phase 3 trials, meaning that these vaccines, the Chinese vaccines, have not completed their mandatory tests before they are certified by a foreign country for non-emergency use. My question to the Minister of Health is, has our policy changed? How can we use a vaccine that has not been certified? The lack of fully prepared vaccination data from official institutions makes it difficult to comment on the efficacy of a vaccine. We simply can't use a vaccine based on a manufacturer's recommendation. We in Trinidad and Tobago would be getting 120,000 doses of the Oxford AstraZeneca COVID-19 vaccine in and about March of 2021. That's in a few weeks from now. That would translate to roughly 60,000 persons receiving a full course of treatment, as each person would require 2 doses. My friends, that is 5% of our population. Covax was set up by the World Health Organization to avoid the international stampede that usually happens after a global pandemic. However, according to current reports, Covax has only secured a fraction of the 2 billion doses it hopes to buy this year, and it is short on cash. Of the approximately 12 billion doses the pharmaceutical industry is expected to produce in 2021, over 9 billion have already been reserved by richer countries than us. Amid fears that Covax can deliver, many developing countries have pulled out of the initiative and are seeking their own private deals with the vaccine manufacturers, and they have been doing so since last year. Concerns have also been raised over the fact that several Covax signatories, including the UK and Canada, are directly negotiating their own deals with these pharmaceutical companies. Some of these richer companies are undermining Covax by taking doses off the market for their population, and you can't blame them for that, knowing very well that demand will outstrip supply. For example, in the European Union, they have introduced export controls on the coronavirus vaccines made in their bloc until they have received their quota. Also in the European Union, they are in dispute with Pfizer, which is set to be short on their production values for the EU in 2021. Low and middle income countries such as Malaysia, Peru, and Bangladesh have stayed in the initiative, but have also inked deals with vaccine manufacturers. The plan was that all of the 190 countries that signed into Covax would be able to access doses in the first half of 2021. But this has not happened, and this was only to a maximum of 20% of their population. This is not enough to get herd immunity. What is herd immunity? Herd immunity is a condition acquired when most of the population becomes immune to an infectious disease, thus preventing the disease. Different diseases have different levels that you have to reach herd immunity at. We are not sure what is the level that will be required for COVID-19, but it is estimated it will be over 80%. My friends, what this means is that both Barbados and Dominica, the 2 countries I spoke about earlier, will be almost at herd immunity with the Indian initiative as well as the Covax allocation. Life will be able to return to almost normal for these populations, and they can reopen their economies to the world. Here in Trinidad and Tobago, to reach 80%, we would have to vaccinate 1 million of our citizens. That is 2 million doses before our lockdowns could stop. Until that time, we would be under health regulations, as it would be reckless for the government to lift it while the vaccine is still circulating in our communities. My friends, Covax, they currently need $6.8 billion in 2021 to achieve their objectives. They currently have raised, according to my research, $2.4 billion. Rich countries around the world, with only 14% of the world's population, have bought 53% of all the world's vaccines thus far. The better vaccines in the market, Moderna, as well as the Pfizer vaccine, have been completely sold out, as well as future production has been sold out up until the end of 2021. Minister Diyal Singh was asked in Parliament the week before, have we engaged with any manufacturers thus far? And he said that we had engaged with Pfizer. My friends, from my research, Pfizer's vaccines are totally sold out. And the minister then went on to say that he's under a confidentiality agreement, and thus, if we ask him anything further, he would not be able to answer. My friends, it seems that we are last in line to be vaccinated here in Trinidad and Tobago, and that would explain why our borders continue to be closed. Those in authority have mismanaged the procurement of vaccines for our citizens. We may be under a COVID-19 lockdown for at least 2 years again. So when will life return to normal? Dr. Anthony Fauci, the top doctor in America, has said you would need to vaccinate at least 80% of your population to reach herd immunity. Globally, 172 million vaccines have already been given out. The US has completed 54 million vaccinations thus far at a rate of 1.6 million vaccines per day. At this rate, they would be at herd immunity in 8 months' time. The EU, the UK, India, Israel, the UAE, Brazil and Germany and Turkey have all vaccinated the majority of their populations. Over 77 countries have begun the vaccination program. I can safely say we are no longer number one in the world as claimed in August 2020. We are in fact at the very bottom in February 2021. I thank you.